My name is Mohammad Ali. I'm an interventional radiologist at Mississippi Baptist Medical Center in Jackson, Mississippi. Interventional radiology is a field that not a lot of patients know much about, but it's a field where we use minimally invasive techniques to diagnose and treat patients' ailments using imaging as a guide. I'm here today to talk to you about uterine artery embolization, which is a procedure of particular interest to me that has an excellent success rate at alleviating the symptoms of uterine fibroids for women who've been living with this condition for sometimes months to years. Fibroids are a very common condition. A very large number of women will have fibroids at some point in their life. Certain populations of women, it is much more common than others. Notably in African American females, I believe up to 80% will have a fibroid of some sort at some point in their life. The majority of fibroids do not need to be treated. We treat women who are symptomatic from their fibroids, meaning there is an effect on their quality of life from these fibroids in their uterus. The two main criteria that we're looking at that may push a woman to get treatment for fibroids are bleeding symptoms or bulk symptoms. Bleeding meaning her menstrual cycle lasts longer or is much heavier than the norm, or symptoms from the pure bulk of the benign tumors on the uterus, whether they're compressing on the bladder causing incontinence or retention, compressing on the bowel causing constipation, pain during intercourse, or severe pain during the cycle. Uterine artery embolization is a minimally invasive technique employed by interventional radiology where a very small nick is made at the wrist or the groin, and catheters are threaded to the uterine arteries, which are the blood supply to the uterus. Next, usually small polymer beads are injected into the uterine arteries to slow the blood supply to the fibroids that are causing the symptoms. These fibroids will slowly lose their blood supply over the next days to weeks to months and will shrink over time, alleviating the patient's symptoms. Many times, women that we see in our clinic have already been seen by a PCP, such as an OBGYN or primary care physician, and have been treated with conservative measures for fibroids. Many of these women have already had an ultrasound documenting fibroids and have not had satisfactory results with the medications or hormones that they've been prescribed. These women may be referred to our clinic, or they may self-refer to our clinic for a second opinion on management of their fibroid symptoms. Once referred to our clinic, they would see and meet directly with an interventional radiology physician. Uterine artery embolization is an outpatient procedure almost always. A patient checks in the morning, and the procedure in itself only lasts 45 minutes to maybe 60 minutes on average. After the procedure, the patient's recovered in our nurse holding area for about 2 to 3 hours before being discharged home. There are very few minimal restrictions, but overall, after 1 week, the patient can usually return to work and normal daily functions. Uterine artery embolization is one of the most rewarding procedures that I perform as an interventional radiologist, and that's due to the very high rate of patient satisfaction overall with the procedure. And what I mean by that is in 3 to 6 months, over 90% of women report a much improved or decreased amount of bleeding if they presented with bleeding as being the main symptom from their fibroids. And over 80% of women who present with bulk symptoms, meaning pressure from the fibroids on adjacent structures, such as the bladder, rectum, or nerves, report a much improved symptoms after 3 to 6 months after the procedure. These symptoms will only continue to improve because these tumors will continue to shrink for years after the embolization procedure. Two benefits to uterine artery embolization compared to other procedures used to treat fibroids, other surgical options, would include a faster recovery time in that the vast majority of women can be back at work within 1 week. The other main benefit, I believe, is a very low complication rate because the procedure is so minimally invasive. If someone's interested in being seen for an evaluation for uterine artery embolization, they can call our clinic directly at 601-714-6400, and we'd be happy to set up a clinic visit.